So good afternoon, everyone. My name is Kessler Brown. I'm on Innovasive's growth strategy team. And first of all, thank you all for joining. What we're going to talk about here is specialty pharmacy and how it has become one of the largest value levers that health systems can pull in order to unlock outcomes and improve margins. Now, at the same time, many of you probably know this, it's also one of the hardest parts of the organization to run well. And so what we're seeing is specialty spend is increasing dramatically. We're seeing access friction also increase. We're seeing payer mandates changing how care is really provided. And so this isn't just going to be an operational conversation. It's going to also be about how do you actually help the patient. So another point on what this conversation is going to be, it will not be theory. It's going to be what can you do in practice. We have 3 leaders here who live this day in and day out, and they actually bring this to practice. So last point here, 4 themes. How do you maximize specialty pharmacy? How do you address access and friction? How do you address payer mandates and how do you work through those? And then finally, how can leaders bring clinical value? So I'm joined today by 3 leaders, again, that live this day in and day out. We have Ashley Van Allen. She is the National Director of Ambulatory Care Pharmacy Services at Ascension. Besides that being a very long title, what she brings is the perspective of how do you run these operations at scale, especially on the ambulatory side. We have Urshila Shah. She is the Senior Vice President and Chief Pharmacy Officer at WMCHealth Network. The perspective she'll bring is broad specialty pharmacy strategy, as well as a clinical lens. And then we have Jigar Thakkar. He is the CEO of Longitude Rx. The perspective he's bringing is, well, he's worked through this at dozens of health systems. So he understands exactly the nuances between health systems, and in addition, how services and technology can improve. So I'm going to start with the first question here. And Ashley, I'm going to hand it to you. The question is, your title is Ambulatory Care Pharmacy Services. How does that work with the broader specialty pharmacy landscape?
Great. Well, thanks so much for having me. So I'm in the ambulatory care space, and I have a team of pharmacists and technicians. We call them our embedded team, and they are integrated directly into our specialty clinics. So these are our oncology clinics, rheumatology, dermatology clinics, and they're really the pharmacy subject matter experts. They're shoulder to shoulder in those clinics with the physicians and clinical staff, and they're helping to direct and manage all of that specialty medication work.
Awesome. Thank you. And then I guess a question for you, Urshila. How does that then lead into the broader specialty framework as Chief Pharmacy Officer of your organization? How do you work with that team in order to provide value?
Yeah, when you set up a specialty pharmacy team or specialty operations, it's not just siloed with the operational piece that Ashley mentioned. In addition to that, you have pharmacists that are doing the MTM piece. Then you have a team that is doing benefits investigation, which includes your prior authorizations and your financial assistance programs, manufacturer programs that are being reviewed. And then you have the dispensing operations. And the governance across that usually falls into the ambulatory pharmacy space that ultimately reports into the chief pharmacy officer perspective.
Got it. That makes sense. Seems like a very critical part of the entire life cycle, from order to dispensing to ensuring that there's adherence. So I guess, Jigar, I want to ask you a question. When you think about, and I know you've worked with dozens of health systems, you think about just one KPI that the health systems should be tracking in order to achieve value, what would it be and why?
Yeah, I think it's a great question. So maybe to backtrack and provide a little background, I think all of you being in this room probably know what we're talking about when we say specialty pharmacy. But essentially, if you look at what's happening currently in the market, 85% of the FDA pipeline is now considered specialty meds, right? So we're up here as health systems and health system partners talking about that because it's become a big part of what every patient essentially is on today. And so your question on KPIs, right? So one of the main KPI that I think all of this really boils down to for specialty meds is time to therapy. So, how quickly and efficiently are you getting the medications that patients need, that they're prescribed, by their physicians? How quickly do they get access to that medication? It sounds like a simple thing, right? But for specialty meds, it's not as simple as that. There's so many nuances, so many different barriers, not only like prior authorization, financial assistance, but even things like, getting access from the right pharmacy. Sometimes even that becomes a complicated barrier, right? So I think time to therapy really boils all of that down into how quickly is a health system doing all of the required activities to then get that treatment in hand.
Yeah, that makes a lot of sense. So time to therapy, very important KPI for the organizations. Ashley, at Ascension, I'm sure that's also a very important one. Where does it break down? Like, where are areas, and I know Jigar mentioned a number of areas that are important for this. Where do you see things working very well or maybe breaking down in your processes?
That's a great question, and we definitely, look at time to therapy as well. I think one of the areas where we see a little bit of, breakdown and friction is in those kind of prior authorizations and navigating those payer restrictions. There's often a delay in that piece, and so we look to try to use technology and other, ways to get those medications quickly to our patients.
Makes sense.
And Kessler, if I may add,
Please.
from when we're looking at metrics, we're looking, definitely agree with Jigger, time to therapy, which is kind of like your operational piece. And then there's a clinical piece to it, which is also adherence rate at 90 days once therapy started. I think of one metric, I'm thinking clinical, operational, and financial, which I would say is your capture rate from your clinics to see what percentage of prescriptions that are being written out of your health system are actually being filled at your own specialty pharmacy. And that is one of the other, because that directly resonates with the margin that you're looking for associated with specialty pharmacy. So I feel like those are kind of the three clinical, operational, and financial key metrics to look at.
Got it. And can you just repeat it one more time for the group? Because they are very important.
Yeah. So as Jigar mentioned, from an operations perspective, time to therapy. And then from a clinical perspective, the 90-day adherence rates for patients. And then from a financial perspective, the capture rate, how many of those, what percentage of your prescriptions from your clinics are actually getting filled at your own specialty pharmacy? And where do you have room to improve?
That makes sense. Jigar, question on where you see the biggest opportunity across those, whether that's embedding people versus embedding technology. Where do you see opportunities to be able to impact those areas?
Yeah, great question. I think both are needed. So expertise and people paired with technology is what's needed. I agree with the metrics that Urshila stated. I think they all relate to each other, right, in terms of how you actually accomplish best in class on all of those clinical, financial, and operational metrics. And I think ensuring that not only you have the right people in place, and so historically, if you look at a lot of vendors that have helped health systems, they bring a lot of people essentially to the mix, right? And that system is good. It does improve capture rate and KPIs, but it only does it to an extent. And I think that's where the technology piece comes in. And we'll talk a little bit later about Innovacer and the platform that we're building, but that's really essentially completely new in the industry, where you really need to pair technology to be able to do this complex work, because it's really not possible just with expertise and embedded staff.
That makes sense. So both are important. Obviously, the technology, you need that in order to do the automation. As much as you can automate to allow people to work at the top of their license, super, super important, but also you need the expertise. Everyone knows that. You definitely need services, whether they're your employees or outsourced, certainly important. I would ask at Ascension, what we've seen at other organizations, so I would like to hear your take on it with Ascension. What we've seen is silos of data. So what we see is that folks will be swivel chairing across different systems in order to find the information that they need in order to do, whether it's 340B, whether it's the prior auth, financial assistance, anything in that workflow. And so at Ascension, is that the case? Have you guys been able to leverage technology in order to improve that?
Yeah, there's definitely still silos within that process. So, our pharmacists and our technicians are working in multiple systems. There's, of course, the electronic health record. That's where we're communicating with the physicians, getting a lot of the clinical data that we need to support prior authorizations and other work that's handed off. We also use our specialty pharmacies dispensing and clinical software, and so that's how we are communicating with our internal specialty pharmacy. We also track a lot of our prior authorizations and financial assistance information in that software as well. 340B has their own software. So as you can see, our team is constantly pivoting between all of these different systems, every day. And so it's something that we're, again, working on trying to get some technology to streamline it. And we want to make sure that whatever technology we select, it's integrated into the workflow, because if it's something that people are having to jump out of, it just creates noise and additional burden.
That makes a lot of sense. That is the operator lens, and I guess from the chief pharmacy officer lens, I'm sure you have your team speaking about those challenges as well. As your organization, do you all have goals to embed more technology or change any processes in order to help, time to therapy and the other KPIs you mentioned?
Yeah, I completely agree with what Jigar mentioned earlier. I think there are the silos that currently exist, and you're really dependent on the leadership that oversee all aspects of that silos to make and connect those dots to then translate the narrative into your peers and to the C-suite to say, here's how my specialty pharmacy is functioning. How are we intertwining all of these different aspects that also Ashley mentioned? So there's definitely an opportunity, and having technology enable that narration is the key, because then it's not just dependent on the people that you place, whether it's in the clinics, benefits investigation, 340B team, and so forth. So kind of having technology that provides that visibility across the multiple domains that still fall under the specialty pharmacy program becomes critical and game changing, as a matter of fact.
Yeah, add something. So, just to add a little bit more, I think predictability is also important, right? So sometimes you have, with all of these different silos and workflows, people operate with like heroics, right? Like, hey, we're gonna get this done, and maybe there's high performance, but it's not really predictable, and it doesn't, consistently happen. And so that's why I would rather kind of build up to a consistent operational discipline with technology, so that it is predictable, right? So, even on our work at Longitude Rx, we're looking at our week by week performance every Friday. And, what I try to stress to our teams is, every week we want to make sure, the things that are predictable, like if we missed something, it still should be predictable, right? It's not that it should be surprises. And I think the way a lot of health system pharmacies operate today really have a lot of surprise factors associated, because of the fact that it's not really built with that discipline, built with that connectedness in terms of technology. And so this is not just a problem, I think, like this one or two systems. I think it's something that exists everywhere.
So with that, Jigar, I actually want to follow up. So we've talked a lot about the technology, right? How can technology support your ability to maximize performance, increase margins, but what can't you automate? I know you all provide services. What are areas where there's no way technology, at least today, can actually fit here?
Yeah, I think you could only automate. I know you guys are in the Bay Area, right? So the San Francisco Bay Area has no limitations on startups.
We're trying to get
and
everyone out of work.
It seems like
Automate
every
everything. Yeah.
startup now is focusing on like context and data, but I think it's still true. Like if you don't have data really in a clean manner, which most health systems don't, it's hard to automate that data, right? So what we're talking about is a very specific use case in specialty pharmacy that can be automated, or aspects can be automated. So your question on what can't be automated, I think there's going to be still like the human factor, the human in the loop that is needed throughout this process. So you could connect all the different systems that Ashley was saying, the 340B system, the Epic EHR. In Ascension's case, they have multiple EHRs. So you're going to have multiple systems where you can connect it with technology, but you're still going to need human in the loop essentially to oversee different aspects of what will be automated, right? So there's going to be pieces that will be automated, like prior auth to an extent these days is actually being automated, right? So I know Innovacer does that. There's other companies out there that do that. There's aspects of multiple steps that are automated, but I think you're still going to need, at least in today's age, a human in the loop, to oversee that process because the data is just not clean enough to fully automate.
And to add to that, the one thing that you definitely can't automate is clinical judgment. So you can certainly standardize protocol based off of disease states. For example, your rheumatology intake, your dermatology intake forms, you can standardize that, but you're not going to be able to standardize that clinical judgment. You can have protocols in place, but clinical judgment will always supersede that. So I think that's one piece in mind. But that being said, I completely agree with what Jigar mentioned, that you have to have these processes.